Okay, welcome everyone. The webinar has been activated. We'll be getting started in about 1 minute as attendees are joining. Okay, welcome everyone. We'll be getting started in just 1 minute. Welcome to those of you just joining. I can see attendees starting to enter. We do apologize for the slight delay with the start of the session. And in about 1 minute, when attendees have joined, we will start the session. Thank you for your patience. Welcome to everyone just entering. Thank you for your patience. We'll be starting in about 30 seconds.
Hi there. Welcome to the 2021 UNC Water and Health Conference. My name is Daniel from RTI, implementers of the USAID eWash program here in Nigeria. Today I would like to specially recognize Dr. Hadiza Mohammed. She is the program manager for a civil society organization called the Federation of Muslim Women's Association in Nigeria. Now, Dr. Hadiza led the COVID-19 response and awareness raising efforts in Niger State, one of our partner states. She actually embarked on this mission meetings with women and youth groups. She also conducted a door-to-door outreach on hand washing across vulnerable communities, ensuring that selected schools had access to water and hand sanitizers in an effort to curb the spread of COVID-19 in the communities. Thank you very much.
We are here to say thank you to Eri Sami, who was the acting head of the Vanuatu Monitoring Evaluation Unit for 6 years. Eri's vision took water safety planning and transformed it to climate resilient drinking water safety and security planning. That includes sanitation and hygiene.
Eri's leadership didn't stop there. He helped ensure water safety planning was in policies and strategies and wasn't just a one-off event. Eri also realised that a DWSSP was not enough. The Department of Water Resources needed a complete cycle to follow up with communities to encourage them to complete their no and low cost improvements, and then provide funding for capital improvements the communities could not afford.
We are grateful for Eri's calm leadership whenever he was the acting director or when he was the incident command center manager of such emergency responses as the recent 2020 tropical cyclone Harold that devastated Vanuatu.
Thank you for your support on so many issues beyond water, such as even hand washing. We think we speak for many when we say, thank you, Eri. your talents, from creatively making a rap song about the water protection zone to your calmness during an emergency and your constant smile, are just a few of the reasons we are so grateful that we have worked with you. Thank you, Ari.
DT Global wishes to shout out to the hundreds of current and former staff supporting our important water and sanitation work in Afghanistan. Our colleagues have maintained their professionalism, commitment, enthusiasm, and hearts throughout the most trying of conditions, including COVID-19, the war on terror, constant insecurity, and the most recent withdrawal of U.S. forces and change in government. Their bravery, courage, and faith to deliver improved irrigation, water, and sanitation to their communities, even now amidst chaos, is above and beyond the call of duty. Our team has constructed over 160 kilometers of water transit infrastructure and supported better management of urban water systems serving 2.2 million people. Even today, as we meet here, they continue to support the delivery of water services to the Afghan people.
Hi, I am Ahmad Masood, a WASH engineer and a PhD candidate at University of Brescia. In this video, I would like to talk about Borda team, specifically Zaina Ainab and Muhammad Talafha. Borda was implementing a sanitation project in a small town in Jordan, but due to COVID and the full lockdown, the project has been delayed. The team decided to work in the front line in order to help people facing the pandemic. They have distributed more than 6,000 hygiene kits at different levels, household levels and school levels. They disseminated the protection measures to the community using different channels. They also rehabilitated WASH facilities in 22 schools, so students can have a healthy environment when they come back to their schools. More important, they bought all the required material for their activities from the local market, and they hired workers and technicians from the local community in order to support them financially in the COVID time.
Hello, and welcome to day 2 of the UNC Water and Health Conference. My name is Allison Lee, and I am a graduate student with the Water Institute at UNC Chapel Hill. We are experiencing technical difficulties with the interpretation services, so we appreciate your patience. We wanted to congratulate all the shout-outs from the video for your hard work and sacrifice. Dr. Hadiza Mohammed, Ari Sami, DT Global employees working in Afghanistan, Zaina Ainab, and Muhammad Talafa. From your peers and from all of us at the Water Institute, thank you. Before we get started with our plenary session, we have some announcements for today. First, we wanted to highlight networking events throughout the week. These sessions are open daily and are great opportunities to connect with colleagues and sponsors alike. Join us for lunch on Pathable and on afternoons on Remo. Please note that you will need to register an account on Remo, and instructions are provided on the website to help you do so. We have an exciting lineup for you today. Following this plenary session, we will have 4 side events that will discuss issues pertaining to policy and equity, water, sanitation, and menstrual health and hygiene. These events will be followed by lunch sessions and sponsor booths. Then join us in the afternoon for verbal, then poster presentations, discussing themes of evidence-based decision-making, water, monitoring and evaluation, and sanitation. And finally, we have networking events and sponsor meet and greets to end the day on Remo. Throughout the day, feel free to hop from room to room to stay engaged in the variety of topics discussed. For our participants around the world in different time zones, join us live tomorrow morning for a recap of today's events. The Late Early Show will feature a panel of WASH experts from Africa, sharing their thoughts on how to apply today's lessons to regions of Africa. Tomorrow, join us for the next plenary titled, Is There a Future for WASH? Just a reminder, throughout today's plenary, you'll find that the chat feature on Zoom is disabled. Please direct all questions and comments to the chat tab on Passable. This tab will save all comments for viewers watching the recording of this session. Due to an
Alison,
issue,
apologies, I just want to interrupt to confirm that for this session only, we'll be using the chat in Zoom due to an issue with Pathable. So you're correct for all other sessions, but in this session, people can use the Zoom chat. Sorry to interrupt.
never mind. Please use the Zoom chat on Zoom for your questions and comments today. Thank you for bearing with us with these difficulties. And finally, we would like to take the time to thank our sponsors. We really would not be able to do this without your support. In particular, we would like to thank the sponsors for this session: Chemonics, Osprey Foundation, and Latter-day Saint Charities. Thank you so much for making this event possible. And without further ado, I am excited to introduce the moderator for this plenary, Clarissa Brocklehurst. Clarissa is an affiliated adjunct faculty member at the Water Institute. She is a water supply and sanitation specialist who has worked more than 3 decades in the water sector. She previously served as Chief of WASH at UNICEF, where she helped establish the Sanitation and Water for All partnership and run the WHO-UNICEF Joint Monitoring Program. She is a former chair of the Rural Water Supply Network, and she is also a civil engineer who trained at the University of Toronto. Please welcome the moderator for this plenary, Clarissa Brocklehurst. Clarissa, I hand the floor over to you.
Thank you very much, Alison. Thanks very much. And I also reiterate the thanks to the participants for their patience as you witness us troubleshooting in real time with some of the problems. This is life in a virtual context. So thank you to all of you. Before I start, I'd like to acknowledge the ancestral owners of the land that I'm situated on. For those of you who attended yesterday's opening session, you'll have heard Aaron Salzberg acknowledge the ancestral owners of the land that the Chapel Hill campus is located on in North Carolina, and to also acknowledge the role that enslaved people played in building the campus. I'm located in Ottawa, Canada, and I in turn would like to begin by acknowledging that the land on which I sit is the traditional unceded territory of the Algonquin Anishinaabe people, and to express my gratitude to them for the opportunity to be present here. We know that participants in this meeting are located all around the world, so I invite all of you to think about the ancestral owners of the land that you're situated on and to acknowledge them. Now onto our panel discussion. The subject of today's plenary panel is the evolution of rural water supply, specifically how it's governed and managed. As many of you know, because you've been part of it, we've worked for many decades on a single management model for rural water supply based on community management led by volunteer committees. When I started my career in the WASH sector, this was the model we used. It had the advantage of being inclusive and relatively simple to set up, but it was based on simple technologies and fairly low levels of service, such as point sources, such as hand pumps, from which users had to fetch water. Today, there's growing interest in higher levels of service, such as piped water on household premises, which is called for in the SDGs, and more professional management. In addition, the distinction between rural and urban areas is becoming less well-defined, and the number of small towns and rural growth centers is growing. So new management models have emerged, bringing with them new roles for communities, for government, and for the private sector. In this context, we're very lucky to have a group of people gathered here with us today who have direct experience of some of these new management models and trends. So I'm very happy to introduce my panel here, and I invite them to turn on their cameras as I do so. Euphrasia Luseka is a water governance specialist from Kenya. There you are, Euphrasia, who specializes in WASH public policy and the institutional strengthening of WASH institutions, including urban and rural water utilities. She's worked with government, development partners, civil society organizations, the private sector, and research institutions. And she's currently co-lead of the Rural Water Supply Network, Leave No One Behind theme and decolonization component. Welcome, Euphrasia. Mr. Bruce Owanakunda is Deputy Chief of Party with Water for People Rwanda, where he's responsible for managing and coordinating the new USAID-funded Thrive WASH activity. He has worked in building the capacity of 3 districts with which Water for People Rwanda has partnerships. And before this, he worked with Rwanda's Ministry of Infrastructure and the Water and Sanitation Corporation. Welcome, Bruce. Just Nancy leads the Africa Regional Program and is the country director in Burkina Faso for the Netherlands-based NGO IRC WASH. He's a specialist in the governance of WASH services. He works on building and strengthening country governance systems at both local government and central government levels. Over the past 5 years, he's worked in Burkina Faso, Mali, Niger, Benin, Senegal, and Ethiopia. Hello, Just. And finally, Dragana Jovanovic is the head of the Department of Drinking and Bathing Water Quality at the Institute of Public Health of Serbia in Belgrade. She's the national focal point for the UNECE Protocol on Water and Health, and she, unlike many of us, is trained as a medical doctor. Interesting way to come into the water and sanitation sector. So thank you very much to all of you for joining us. So I'd like to open by asking each one of you to describe what you see as the big changes in rural water supply management in the country or countries where you work. How have the changes manifested themselves, and what benefits and challenges have they brought? I'm going to start by calling on Just, because Just, you work in Burkina Faso, also in Mali. What have you seen in those countries in terms of changes?
Yeah, thank you very much, Clarissa, and hi, everyone. From my experience in the region, the changes in rural water started in the early 2000s, and so almost with the MDGs. And these changes were promoted as an alternative to the community-based management model, which had fallen short in terms of meeting performance expectation, especially for piped water systems already installed in many big villages at these times. And then the evolution was mainly aiming to ensure effective and sustainable service delivery with rural piped water systems, serving about 25% of the rural population in West Africa. And so far, I've noted 5 major changes in West African countries like Burkina, Mali, Niger, Benin, and Senegal. The first one is the introduction of qualified and legally recognized companies, mostly private, in the role of service operator, assigned to deliver operating and maintenance tasks with clear specification. And the second change is the introduction of local public authorities, following the decentralization processes in these countries, in the role of asset holder and contracting authorities. The third change I've noted is the introduction of service agreements between both service authorities and service operators, enhancing the mutual accountability of both parties for achieving agreed performance of service level. And the fourth one is the clarification of the role of central government as a service regulator as well as investors. And the fifth change I've noticed is the clarification of the role of communities, either as citizens, so taxpayers, or relating them with the local authorities, or as consumers, tariff payers, relating them with the service operators. And altogether, these changes are now increasingly identified as utility managed rural services in some references in documents in the bibliography. And in most countries, these changes have improved the functionality of piped water schemes in rural areas for thousands of consumers over the past decades. But they also came with new challenges, raised new challenges. And luckily, since 2015, with the SDGs, we've got a clearer framework for service levels by promoting clearly safely managed services, which pushed many countries, many governments in West Africa to make stronger commitments in rural water to improve and upscale first piped water as preferred infrastructure in rural, and also utility managed model as mandatory option in many countries. So that's what I could say about this first point, Clarissa.
Okay, great. And just we'll come back to you about some of the points you've made, particularly about the role of communities and the private sector. I'd like to turn next to Euphrasia. What have you seen in Kenya? Are you seeing similar things to what Just is describing?
Indeed. In Kenya, I would like to pick up from his points on the issues to do with stronger commitments. If you ask me the same question you're asking me today, 11 years ago, when I was submitting my MSc dissertation paper on this same topic, I would have painted a bleak narrative. But thanks to the power of research and influencing policy and the relentless collective lobbying efforts of similar water governance practitioners like myself, I can be able to share with you a more positive kind of story that can also be adaptable. Now, in the Kenya water sector, the water sector reforms started in 1999. And in 2010, we had our constitution being promulgated. And at that moment, we have an article on it, on Article 43, that entrenches safe water access as a human right. And it's in tandem with the tenets of the human right to water and sanitation. And this happened at around the same time that the human right to water and sanitation agenda was being also propelled in the sector. Now, in this same constitution, we had devolution coming in, and we now have decentralized systems of government. We have both the national as well as the subnational government that we also term as county governments. Now, the critical determinant of devolution in the Kenya water sector is going to be how the county governments, as the primary duty bearers, can be able to develop as well as operationalize a resilient water system that is demand responsive, that is accountable to citizen needs. And therefore, what we have been able to see for the past 11 years is something that I would term as no longer business as usual. It's different. Indeed, we are also seeing stronger commitments here in Kenya, and which is in East Africa. And in this regard, we have seen a lot of commendable efforts coming into the rural water sector, because the focus again was that how can we be able to address the weakest links in terms of water access in the country. So they targeted the underserved as well the unserved. And in this regard, they fall mainly in the rural areas of the country. And here we decided to see how we can be able to work on reducing these inequalities, taking up interesting approaches like the leave no one behind principle, as well as focusing on last mile connectivity. And a lot of policy efforts have gone into place and again have been realized. I would like to talk about the policies on service delivery management models in rural water services provision that have happened both at the national as well as the subnational level. We are also seeing legislation being enacted. At the same time, the national water regulator has been able to develop guidelines that are guiding water service water sector practitioners on water services provision in both rural as well as in underserved area. And again, they have also gone ahead to also develop another guideline that is coming in to support the clustering agenda. And in this regard, it's supporting a lot of efforts towards ensuring commercial viability of water services provision through the economies of scale. Just last month, we had the Minister of Water coming through and appointing a water task force to support on issues to do with debt management of water sector practitioners, as well as advancing on financing of SDG 6 in the country. And this has been able to support a lot of progress in rural water sector practice, as well as the supply agenda. And I would say that it has provided a lot of soft landing for many new actors. And so far, we cannot be able to claim perfection, but I would say that we can be able to claim progress. And now the sector is ready for more service delivery management models. I'll pick the rest on how new actors are coming in the next part. Thank you.
Okay. Euphrasia, I'll just ask you for one quick clarification. You mentioned clustering. Perhaps for our participants, you could explain what clustering means.
Well, with clustering, what we are looking into as a country is how we can be able to group several rural water service providers or even water service providers in underserved areas. They not necessarily not need to be in rural areas. They can also be in urban areas or peri-urban areas and small towns. And we bring them together to be able to achieve economies of scale, because again, water services provision is quite an expensive task. And in that regard, when they are together, you can improve business development strategies a little bit better and improve access faster. Thank you.
Thanks very much. Okay. I just wanted to make sure that everybody was clear, because that's a very important point is in some of these different models. I'm going to turn to Bruce now and ask him about his experience in Rwanda. How much of this resonates with you, Bruce? Are you seeing similar trends in Rwanda?
Yeah, thank you, Clarissa, and hi to all the participants. Yes, there are similarities, and Actually, even I'm even tempted to say that even the journey is somehow like a combination of what just said and what Efresia just said. In Rwanda, no, I hope, I don't know if everyone is familiar with Rwanda. After the terrible and horrific event that took place in 1994, the genocide against the Tutsi, is like all the aspect of life in the country, like infrastructure, social life, economic, was purely destroyed. So the government have to build from scratch to normal life. That is also the same for water supply services. But for water supply services, it was like a bit of a new innovation. So when the government started to rehabilitate or construct new water supply systems, the water supply systems were managed by the communities. So there were no proper management, there were no framework. So that's like the government were constructing systems and handing over to communities. However, with that, in around 2003, the government realized that there was no one accountable. We have like 1,000 communities in the same district who are managing different systems. And therefore, if there is a repair or if there is a leakage or if there's interventions to be made, no one knows who to address to. So it is that period that the government decided, what if we introduce a new business approach, a new public-private partnership, so that instead of the systems being managed by the communities, they should now be managed by private people who will be doing business. They'll be handled the facilities on behalf of the district. They'll be managing them and selling the water. And so that approach worked. But the problem was like now, instead of having thousands of community managers, we'll have like 100 managers. So that means each single system was assigned a specific private operator. But that one could not work because then the district will have like 100 contracts to manage. And you imagine one water supply and sanitation officer at the district managing 100 contracts. It was difficult. So in 2015, that's when we introduced what Efresia just mentioned. Let's see how we can cluster the water supply systems and reduce the number of POs. So with that, it has come to at least 2 private operators per district, and each managing around 40 to 50 water supply systems. And there are conditions like you need to have personnel, you need to have staff, and there is a national tariff regulated by the regulator. So there was a proper contract, and if there's something failing, if an area does not have water supply services, the district will know to who look at. Now, this one is even going to improve, as now we're even introducing a new approach. Instead of leaving it to the private operators, we want to bring back the community in a way of saying that where service providers are operating, let's see how we can have water users committees at village level, at system level, so that those are responsible to oversee or to monitor how the service provision is provided to them. And of course, the service provider, the private operator, will work with a water seller, a water vendor who is elected among the community members. So there was this complementarity between the service provider and the communities. In addition to that, we have a district washboard, specific district washboard at a district level, who is reporting to the district council for all the issues related to water supply. If the community have complaints, if the communities are not satisfied, the service provider is misbehaving, the water users committee, the water sellers, the water vendors may report to the district washboard, and the district washboard will communicate it to the district authority. If the district authority does not take action, they will take it to the district council, and necessary action will be taken. So I will just stop there, and we can exchange more during this panel. Thank you.
Thanks very much. Thanks very much, Bruce. So finally, last but certainly not least, I'm going to turn to Dragana. Dragana, our other 3 panelists are based in Africa, but you're based in Europe. Have you experienced some of the same challenges in the management of rural water supply in Serbia, and how have you seen models there changing recently?
Thank you, Clarissa, and I would like to send greetings from Belgrade to all participants, and I'm very glad that I am a part of this panel. Actually, yes, this is a common issue, I think, in all countries in the world, and cross-cutting issue also for the operation and management of rural water supply systems. In Serbia, like I think in many countries, local self-governments are responsible for providing drinking water service to all the inhabitants. But in practice, this is not like that. Actually, drinking water supply is better organized in urban areas, and the public utility companies operate and manage drinking water supply system in urban areas. But in rural areas, somehow villagers organize themselves and build their own drinking water supply system. Even in some villages, there are several, actually few houses organized and build some systems. And according to our regulation, what is public water supply is supplying is up to 5 households and 20 inhabitants. We consider that as a public water supply, and it according to law and according to all rule books, they are obliged to operate and manage system well, and according to all to be monitored, to monitor drinking water quality, etc. But it is not the case in practice. And what we see is that many rural water supply systems do not have their owner. The ownership issue is a big problem, because when you want to manage something and to bring it to some new or good order, you have to have some owner of the system, and that is a big problem. That's why communal inspection and the government brought decision to for a public utility company to take over management over the rural water supply systems. But it is also challenging because there are many, and they do not know the real situation, infrastructure related to infrastructure, related to other relevant items and issues for taking over that management. And on the other hand, consumers or people in villages will face another needs for payment to pay for service, which is not the case now when they where they do not pay for water because they manage the system by their own.
Okay, interesting. Thank you to all four of you. And I find as I'm listening to you, there are various things that are coming out very clearly. You know, several of you have mentioned regulation and regulators. Certainly when I first started working in the rural water system, there were no regulators and there was no regulation. So this is a very welcome thing that's coming into the sector. This idea of clustering and aggregation, trying to bring some of these very small systems together so that they can reach economies of scale. The role of private operators, something again, very, very new, relatively new in this sector. We're looking at models to try to make that work. But in particular, overall, I think one of the threads through all of what you've said is new roles for government. And I think that one of the reasons that community management of water supply was often established in the past was that governments at both the national and the local level were very weak. And this was a way to make up for the fact that you had very, very weak government. And so you placed a lot of responsibility on the community. Now that we're trying to raise levels of service, get more investment in the sector, there's obviously a clearer role for government. So what do you think that governments need to do differently? What would you call on governments to be doing And I don't know who wants to take that question from me first. Euphrasia, do you have thoughts on that? What we should be calling on governments, particularly at the national level, to be doing?
Yes, I do. I think that, again, the human rights to water and sanitation agenda squarely puts the role of water services provision to the governments. And when you look at the development aid report in 2020 that was released, it indicated that WASH funding has been decreasing, and it has decreased actually it did not increase last year, even when we were considering that safe water access is the first PPE against COVID-19. We even saw the UK cutting WASH funding in almost 80 to around 80%. And this means that developing countries need to wake up and get organized. And I want to take the example of the United States Agency of International Development premise that states that the purpose of foreign aid should be ending the need of its existence. And in that regard, I would request the governments in the South, to now also come in strongly and be able to make efforts in leveraging on such agenda. And then at the same time, they need to see how they can be able to localize the SDG 6 in its totality, especially on rural water access. And this is because in Africa, almost 70% of its population is situated in rural areas. And governments are coming in strongly to put in a lot of effort on health, in education, in industries and the likes. But I would say from rural water development experience, the moment you put up or you lay down a pipe of water, then schools are going to come up, hospitals will come up, because water is not a sector. Water is a resource. It's a catalyst for development. And in that regard, if we are really serious, and even if government is really serious on development in its country and also going or moving from foreign aid, probably that it needs to put its money where their mouth is. And in this regard, I'm talking about progressive rural water budgets increment to realize the SDGs 6 targets. I'm talking about managing the seepage of these funds that are allocated, whether it's external or maybe domestic funding, through proper procurement, as well as contracting processes for asset development and management. I'm talking about them moving from politics to ensuring that we have services provision. Politics is visual. Politics is about 10 boreholes being built, but development is ensuring that we have 50,000 people accessing water from such a development agenda. I'm talking about them supporting reduce the gap between research and policy and moving pilots to projects. I'm talking about them building capacity. And lastly, I'm talking about them harnessing on the role of collective action in ensuring that rural water supply is managed well. I would like to close by saying that CSOs are your friends. Stop running away from them, governments. Thank you.
Thanks very much, Euphrasia. That's fantastic. And it's interesting, you're talking about scale, and you're also jumping ahead to one of the things that I wanted to talk about, which was the role of development partners and the role of foreign aid. And you've made the point that this is all about using foreign aid catalytically and reducing dependency. And in fact, I'm trying to monitor the chat at the same time. I've got Louis Burstin helping me monitor the chat. And I see that there's lots of conversation going on there, which is great. And I'm going to turn to Bruce and just to see if they want to add to what you've said, in particular, how these new managements are going to influence the trend on dependency on external donors for capital financing of rural water supply systems. What do you think are the implications of some of these new models for this landscape in which we live, in which there has in the past been huge dependency on foreign aid for rural water capital investments in particular? Bruce, just which one of you feels most strongly about that? Bruce, I can see you waving, so go ahead.
Yes, thank you. That's a very, very good question, and maybe food for thought, because I would like maybe to start by saying that whatever we are doing, if we want us to have this, some of these models or be adopted at national level, we need to have a political will. And the political will, most of the time, does not even stop at country level. We need to even see international level.
Oh, Bruce, you froze for a minute there. Maybe there's something wrong with his connection. Just, do you want to come in, maybe finish his sentence?
I was more tempted to get back to your initial question, if you allow, about how governments are managing these changes and are trying to be on top of the challenge, because I think this one is really critical. From my observation first, national governments in West Africa, where I've been monitoring the situation over the past decades, they have been leading on the promotion of what we can call utility managed services, service delivery models in rural areas. They've been leading on this by providing clear national policies and frameworks to local stakeholders and facilitating the rolling out of this new model. But in the same time, they've been struggling from various studies and observation and experiences in many countries. They've been struggling for monitoring, for learning and adapting the model. We've seen and we've heard about many experience of adaptation, but still many pending. Because all this is tested in complex realities faced by local stakeholders. And then, for example, we have authorities who couldn't meet their commitment to finance major maintenance to the schemes as planned in the model, or they couldn't finance the need for expanding the schemes to meet the new demands, because there is the population growth, so demand is increasing. And these situations happened, from my experience and observation in Burkina, in Niger, and many other places, and central government didn't address them properly, or are still, they're very slow in addressing them, while people on the field are really suffering. And in other cases, we've had the cases where the tariff agreed with the service operator in the service agreement were not viable in practice, either for small scale, but there are many challenges, similar challenges, and local authorities didn't know how to manage this, and central governments were very slow in responding to these challenges. So generally, I could say, from my observation, that public authorities at central or local level have been struggling for fulfilling their mandates in the new model, either as investors, and I've seen some comments in the chat box related to that, or as regulator. And this needs to improve quickly, because I think, government needs to improve monitoring, they need to improve learning, they need to improve the procedures so that they can really adapt faster than they used to do at the moment. This needs to happen continuously so that national policies and guidelines are really aligned and adjusted to fit the challenges people are facing on the field. That's what I could share about this at the moment. I think central government needs really to, I think, that one is also important, to provide really the funding to meet the increasing demands, because they're not used to plan ahead to meet this demand growing from and raised from the field due to the fact that pipe water is run properly. Then people are relying on this increasingly, and they should be ready to invest into it when needed. And this is not happening at the moment in many cases, and this needs to improve. So these are some ideas I could share about the challenges that are faced by local and central government in West African countries.
Sorry, I was muted. Somebody had to do that. And I see that Bruce has been able to reconnect, so I'm glad you're back on, Bruce. Maybe you'd like to pick up what you were saying. I mean, I think it's interesting that Just mentioned the lack of capacity in local and national governments, the need for planning, and I think that that's a very important point. Rural water supply has not been very well planned, and certainly not planned at a local level in the past. Is there a role there for development agencies to do the kind of capacity building that would then empower those governments to be able to perform those functions? Have you got thoughts on that, Bruce?
Sure. Yeah, I stopped where I was mentioning the political will, both at national level, but at global level. The reason why I started with this is because I wanted to raise the concern of, if we don't have strong wash system in place in countries, we'll never have sustainable wash services in place. We'll never reach the SDG targets. So it's not only a matter of having the private sector doing well, the government doing well, the financing doing well. If they are not working together, they will not succeed. So there is a need for development partner to come and build the system, the wash system in the countries, not only come as aids, but rather to build the system of the countries, the wash system in the countries. The only way to do that is to build the capacity, to help them to prepare a good framework, good policies, good strategies, but also have strong regulations, have people accountable, hold private operators accountable, have government accountable. So there are different capacity building aspects in those different building blocks. But if we don't have the building blocks working together, the sustainable service, water supply service will never be achieved. And that's where development partners need to come in. They don't need to come in as we want to help you to build the 10 system, 30 system, 100 systems. We need to help you to build your strong wash systems in the country so that the government does not have to rely on development partner every time. Thank you.
Every time, right. Thanks very much. And I find it interesting because what I hear you all saying sounds very much like the conversations we've had in urban water supply for many years about planning, about regulation, about planned investments. And I see that there's one of the questions from Richard Carter has been, when will we stop talking about rural water and urban water as though the principles involved were different? And I think that's coming out loud and clear. Strong regulation in particular. And Dragana, you also mentioned the role of regulators. Do you want to talk a bit about the situation in Serbia and how you see it from this context? I assume that you have less dependency on external actors, but how have you address this issue of low capacity within local government when you want to have things like strong regulation?
Yes, actually, we have at one side the national level and at the other side local level. National level set legal framework for drinking water supply. Local level is also obliged to set local regulations, and it is not how to say fulfilled in practice. We have to also push all local self-governments to set decisions and regulation at local level. And also, but the other hand, on the other hand, at the national level, we do not have a national, how to say, water body for rural water supply, or to see overall picture, or to monitor all water supply system, either rural or urban water supply systems. So I think that we need more involvement of national government and national level to local level, and to set to support them in capacity building of public utility companies, which we have at each municipality. And but in the meantime, in this transition period, we other sectors like health sector support local self-governments through building capacities in water safety planning approach, to train first health professionals how to introduce and how to implement water safety planning approach, and then from the network of the Institute of Public Health, we then train local self-governments and public utility companies to implement and to introduce and to implement water safety planning approach for better management of drinking water. And in our new draft law, we just have introduced that obligation of mandatory water safety planning in our water supply systems. So what is the big the huge challenge for the uptake of for international funds is that actually all of them asking for very clear and nicely developed project documentation, which it is not a case when you have some small water supply system without ownership, and if you do not know what is built in that system, what is the infrastructure, what is the material, and etc. Built in that system. But we try to how to say, make it more transparent, and now to set up and to set up that project documentation, to prepare that project documentation to be allowed to access that financial funds.
Interesting. Okay, so you're also looking for well-documented systems approach and transparency and training. I find what you said about involving other sectors like the health sector very interesting. I'm going to come back to our other panelists, and maybe if you have something to say about the involvement of other sectors, please do. But I understand there's a very vigorous conversation going on in the chat about private sector management versus community management. I'd like to think we could have the best of both. So I'd like to turn back to you and ask you, just because we don't use a pure community management model anymore does not mean there isn't a role for the community. I think a couple of you have already mentioned there's a role for the community. So I'd like you to speak to that. But before that, I want to go back to Justin and just have him talk a bit more about the role of the private sector, because I know you wanted to speak to that. So do you want to kick off by talking a bit about the role of the private sector, but also some reflections on where that leaves communities and what their role should be?
Yeah, thank you, Larissa. I think that's a great point. And I think the priority expectation from the private sector is to provide qualified staff and to run effective business model for operating and maintaining the rural water schemes. With the ultimate goal, if I put this in the framework of the SDGs, to reach safely managed services for the majority. So I think the private operators should strive to fulfill their role first, but also to influence public authorities for the enabling environment, which lands with the system approach, as very well explained by Bruce. This is really critical because the private sector could have all the goodwill, but they cannot really perform if the environment is not conducive. So that's my, let's say, my contribution to what we can expect from the private sector. And then this doesn't mean, as you rightly said, that communities don't have any role to play in this setup. I think the new roles assigned to the communities are clear. They act either as citizens, so taxpayers relating with the local authorities, or they act as consumers. They're paying the tariff and they're then relating with the service operators. So these are the critical role, and these are quite these roles have been quite successfully experienced and sustained in urban water, as well as many other public services, such as health and education. So this is not something really new. It's just learning how communities can really contribute properly to the provision of services, public services. And I think the challenge then for public authorities and their partners, donors, NGOs, etc., is then to support the communities for playing effectively these roles. And I think we have good examples. I can share the one I've learned from Benin, where the central government planned and budgeted for strengthening these communities' roles by promoting what they call water consumers associations in each district, with clear mandate for promoting and defending consumers and citizens' right to water. And I think these are really clear, and I think that this is sustainable, actually.
And so what you're saying is that the village committee that before used to shoulder a lot of very technical tasks would not be doing those technical tasks. They would be done by people who had far more professional training and better access to supply chains, but the community, that committee would still have a role to play in terms of accountability. Yeah. Bruce Euphrasia, do you want to add to that, maybe with some of your own experiences?
Yes, I would like to mention that the Millennium Development Goals give the private sector a platform in the rural water sector management agenda. But now the SDGs is coming in, especially with SDG 17, it's coming in to give them a role as well. And when we see various advancements as well as commitments from governments in terms of policy, legislation, financing, creating a competitive market in terms of innovations and how they're coming in with the digitalization and automotive processes, we can say that we are no longer seeing the rural water sector being a high-risk sector. And it's high time that the private sector can be able to come in and harness or actually exploit these untapped opportunities. And I'm actually talking about various opportunities, like for instance, in Kenya, they are now coming in supporting the management models. Before they were only coming in for financing. And I'm talking, I'm raising this from the perspective of what Just has just been able to mention. Now, they are managers of these rural water projects. They are supporting in coming up with business development support strategies. They are basically also bringing in new innovations and technologies. And overall, it's supporting rural water supplies to be able to decrease the operation and maintenance costs. And to this level, they're getting to a level of commercial viability. And rural water supplies are no longer high risk. They can be able to walk into a bank, get a loan, and be able to expand coverage. In our country last week, we saw Aqua for All partnering with a national bank, and they were able to come up with a loan facility of around $5 million. And these are some of the financing products that we are actually pushing for the rural water supplies to head to, and various other donors in the sector have also been able to champion the same. Now, also coming on the role of the communities, they're not going to be left idle. We also have the water action group, similar to what Just has mentioned is happening in their countries. In our country, the national regulator has come up with a water action group that supports communities to take up their roles in a different perspective, given now the shift in terms of management of rural water utilities. So communities have a platform to now come in and talk about and actually demand for better water rights, public participation in policy development, as well as budget development, citizen engagement processes, and the likes. At the same time, what we are also seeing in Kenya is that we are also using them to champion the agenda of multiple use systems of water, so that when one gets a water connection, it's not just about using that tap for drinking, but also translating the tap into an income generating activity. I mean, 3 out of 4 jobs are connected to water. And I don't then understand then why we have high poverty levels in rural areas when we have a resource that we can be able to tap into. So the community managers still have a critical role towards this, and they can also leverage further on what the targets on SDG 16 is actually providing for them. Thank you.
Thanks, Euphrasia. And I think you've touched on something that I understand there's a lot of talk about in the chat about this issue of commercial viability. And is it possible to make rural water supply commercially viable? You've made the point that it can be linked to livelihoods, to income generation. Bruce, do you have, you're looking very thoughtful. Do you have anything to say about that?
Yeah, I just want to bring another attention is that in addition to building the capacity of the private operator, but we're also building the capacity of the district in terms of looking at all the costs, not only at infrastructure development, but rather looking at full life cycle investment. If we are building a water supply systems, we need to build it in mind that this system is going to be operated and maintained, it's going to be replaced, and it's going to be monitored by people. So when we go to government, we don't want to give them that new water supply system costs. We need to give them full life cycle costing investment costs, so that when a district wants to do fund mobilizations, they do fund mobilization for all the costs, not only for constructing new water supply systems. They need to make sure that there's a percentage of that cost that need to be allocated for operation maintenance, for capital replacement. Now, Euphrasia mentioned something good, like we all know that the source of finance for the water supply comes for the 3T, it's tariff, taxes, and transfers. So sometimes the tariff is very difficult because it's how do you set an affordable tariff that is going to satisfy the population, but also allow profitability for the service provider. But when those are not enough, where do we get more funds? It's either through the blended finance, where can we have social loans? Can we have long-term loans? Can we have bonds? Can we invite people to invest in water supply system? So yeah, that's one of the approach that we had. Instead of the traditional investment plan on looking at new water supply systems, we are now encouraging districts to produce full life cycle costing investment plan.
Okay, and that's a level of complexity that we haven't had to deal with before. So it requires a much higher level of capacity to be able to do that full life cycle costing. And certainly if you're expecting local governments to be able to try to raise money themselves, maybe even going to commercial finance, that's a level of complexity that we haven't seen before. So we know that many of the people in our audience, many of the people who attend the Water and Health Conference work for development agencies. They work for NGOs, some of them work for bilateral agencies like USAID or the British DFID. What advice would you have for those of us who are working in that sector and want to know what is the best thing to do to support these new management models? And in particular, what do you think we should not do? What are things that perhaps have been done in the past that it's time to, some practices it's time to retire? Do any of you have thoughts on that? What would your advice be to development actors? Just if you're nodding, does that mean you want to go first? You'll go first, and maybe I'll go through one by one.
Okay, thank you. Now I think development partners have an important role to play because they used to be critical players and support to rural wash agenda. And I completely agree that we should really shift the paradigm and stop thinking only rural and segregating rural and urban, and considering that, yeah, we have a goal to achieve and then we provided the right model for getting there. So I think development partners, from my experience, should increasingly support utility managed model in rural water. And they should follow the, let's say, the commitment of countries to preferably invest in piped water, even for rural water, rather than water source like hand pumps. But this depends on the context, but everywhere it's possible, they should be supporting piped water and supporting the country to provide utility managed model or to implement a utility managed model. I can hear some reflection about promoting private sector, the role of private sector, etc. And for me, I think the operator could be either fully publicly owned or privately owned or hybrid, depending on the country context. The main point, the priority is to ensure professional management. And this is really critical. The second point is effective accountability. So clarifying roles, division of roles is really critical for accountability. And that's one of the things that failed in the community model, community management, as people were at the same time service provider, service authority, and that's a mix of roles that didn't help for accountability. And the last bit is about sustainability. Sustainability means having an overview of all what is needed to sustain the service, but not only, but also fulfilling the increasing demands, addressing the increasing demands. So that speaks to the point rightly raised by Bruce about life cycle costing and recovery, life cycle cost recovery. So I think development partners should support country stakeholders to roll out national related policies or guidelines, they should increasingly support strengthening country and district systems to really be up to the challenge and improve both the development of piped water and the implementation of relevant operating model. This goes through skills, local capacities, local tools, procedures, etc. And I think in my end, my last word would be that the development partners should also support knowledge management related to this specific new areas, because we still have a lot to learn about how this can work. And not everything will work from the first tests. And so we need to be able to learn and to improve. So evidence-based continuous learning and adaptation of policies and guidelines would be something critical that development partners should be supporting countries to undertake.
Okay, thanks very much, Justin. And I've just seen an interesting question about how do you square this with donors who often want to claim sort of attribution. There has been a tendency among development partners to want to be able to, show that they're having results. And this is often done by, as you know, counting the number of water points or counting the number of beneficiaries, but you're talking about a different model of assistance. Do any of the others on the panel want to come in? Dragana, I'm not sure whether to call on you and how relevant this is in your situation, but I think you do have external support from EU partners, et cetera. Do you also want to speak to this issue of what external development partners should do? I have a feeling we have just lost Dragana. Oh, you are there. Do you want to speak to this?
Something was...
No, I think there was a glitch. I think it was a glitch. You disappeared for a minute. I was talking about the role of external actors, and I'm not sure how much of this applies to you, but you do have EU support. What is your feeling about what the role of external donors should be? But I'm also looking at Bruce and Euphrasia because I'm quite sure that they have things to say as well. Do you want to come in on this, or shall I?
Yeah, I can just add something from our perspective. I think that, as I said, public utility company is only a legal entity in Serbia that can manage and operate drinking water supply systems. So we here should support our local self-government, which established public utility company to empower public utility company to take over management operation of small systems of rural water supply systems in terms of human resource capacities, technical capacities, infrastructure capacities, everything that is related to full capacity operation and maintenance of rural water supply system. So I think, and also for the national level, it is very important to establish systematic approach of registering these water supply, small water supply systems, because now I think we do not really have a systematic register of rural water supply system. We don't have, we don't know how many there are, and that systematic approach is really very important to conduct some capacity need analysis for small systems, and also for public utility companies, some capacity need analysis that then we will have a clear picture and better picture for each local self-government and each public utility company, what they really need, what support, yes, what support they need actually to take over this. Yes.
Thanks very much. Bruce and Euphrasia, do you want to come in on your advice to development partners? What kinds of things they should and should not be doing? Bruce, maybe I'll call on you.
Euphrasia, you want to go first? No problem.
Bruce, you can go ahead, please.
Oh, okay, you're both too polite to each other. Okay, Bruce first.
Thank you. Yes, what I would like to maybe an advice to development partner and donors. We all agree, and I've been reading in the chat. Wash business is the only way to go. The supporting or the donor, no one will come to donate for a water supply service provision. It might help, it might support, but it will not solve, it will not be sustainable. The only way to achieve that is, I hope I'm not going to repeat myself, is through establishing strong wash system, the building blocks, having the building blocks functioning. And if we have the building blocks functioning, if we have the government responsible, we can pave the way for the sustainability. And another thing, another advice is that we need to stop supporting only new investment. We need to support full life cycle costing. If we only support new investment, new water supply systems, new constructions, they will have to come back every 5 years to reconstruct the same. Because if they are not well maintained, if they are not well replaced, if they are not well monitored, after 5 years, they will fall apart and the investment will be lost. So it is good that the donors, the development partners build the district capacity wash system strengthening at national level in implementing full life cycle costing. Thank you.
Okay, thanks. Euphrasia, we're coming to the end of the panel. I'm going to ask you all to make a closing statement soon, but Euphrasia, do you want to speak to this before I do that?
Yes, I will speak into that and also move into the next session in usher it in. I would say that although the implementation of service delivery management models is expected to generate a lot of benefits that widely exceed the cost itself, I would say that still, ladies and gentlemen, some hundreds of billions of dollars are required to be able to ensure that we can be able to meet SDG 6 in rural water sector. And needs are greatest in developing countries like mine. And this calls for an increased mobilization of both the domestic funds and also a significant support from external funding. Now, much as we have been able to agree on the same, I would say that collective action makes the role of the local governments to be almost similar to what we are expecting from the donors. What the donors are supporting in the rural water sector should be almost the same to what the national governments are also implementing on the same. But external support is anchored on something different. It's anchored on SDG 6, target 6A, which seeks to expand on international cooperation and as well as issues to do with capacity building in developing countries. And from personal experience and my work itself, I have seen impactful north to south and south to south government to government partnerships in the rural water subsector. And we have seen that from USAID. We have seen that from political and economic unions like the EU through their WAP programs. And this is just to mention but a few. However, there's a gray area that is missing and what we really need to address from the perspective of the donors. And this is on the role of foreign aid in rural water access, especially on localizing the agenda. Much as the donors are doing an amazing job supporting developing countries, probably it is high time that we also come in to inquire how are foreign aid policies working in the developing countries to enhance accountability on its agenda? How is it ensuring a win-win approach to enhance diversity, equity, as well as inclusion? Until we can be able to agree on some of these things, then other issues like addressing the systems approach and even adapting such innovative management models would be a little bit easier. And you know, sometimes we say in my country that a beggar is not a chooser. So sometimes when the donor funding comes in, maybe communities or the government can be lured into taking up whatever can come in, even despite management was not being effective. Then lastly, I would also like to address the issue of data. you cannot be able to change what you don't measure, and you cannot measure what you do not know. And that is the situation of rural water supply in Africa today. Most countries do not have a national national management information system. So here we are, we're trying to attain SDG 6 through various innovative approaches like SDMs, but guess what? We are not counting. So we cannot really know the impact of the work that we are doing. Let us get the data right. Thank you.
Okay, thanks, Euphrasia. So I hear very clearly from all of you saying, you know, we should be open to new management models. We should be looking for ways to transition to what we've been doing in the past to some of these new management models. We need to take everybody along with us, including foreign donors. They have to be open to some of these new models, and they have to make sure that the assistance they provide, in fact, enable these new models and are not so rigid that they're based on models that we actually want to adjust and grow. I'm going to ask each one of you to make a wrapping up statement, literally one sentence. And the question I'd like for each one of you to address before we wrap up is just, how optimistic are you? Looking at these new models, looking at what's happening in the rural water supply sector and still all the remaining challenges, are you optimistic that these new models are going to bring us success? So I'm going to go through in the order that I happen to see you on my screen, which is that I've got Just, Euphrasia, Bruce, and Dragana. So let me know.
Okay, now thank you. Now, personally, I'm very optimistic. I think we've been moving in the right direction. We've been making good progress over the past decades, and SDGs are really enabling and comforting us in the way that, yeah, we need to improve first the kind of investment we're making in hardware in rural water. So going from water source point into piped water. And we need to improve significantly service delivery models. So adopting utility managed services. This is the way to go. And I'm very optimistic based on the evidence provided over the past decades. Thank you.
Thanks. Just that was the longest sentence I've ever heard, but well done. You packed a lot into it. Euphrasia?
I would call on data. Let us get the right data for rural water sector, and let us move our pilots into projects. Thank you.
Thanks very much. Lovely short sentence. Bruce.
Yes, same from my colleague. I'm also very optimistic. We have seen evidence and proof that the government are willing to adopt these new models. We have worked with them to pilot some of these things we are talking about here in some districts, and we have seen evidence that things are moving. One of the things I would like to mention, which we did not tackle here, maybe we should look at another venue, is the climate change impact on water supply services. So water is at risk, not only in terms of infrastructure, but in terms of pollution, in terms of getting it polluted, everything. So as part of the investment plan we are making, let's put a portion for water resource management so that we know that where we are getting our water will continue to be there in good quality and in good quantity. Thank you.
Okay, thanks. And finally, Dragana, are you optimistic given all the challenges that you face?
Yes, I'm always optimistic, and I would say that we need a systematic approach and also multi-sectoral approach and multidisciplinary approach, and to see what we have and what we need to do with our systems.
Okay. Thank you very much. Thank you to all of you on the panel for a really interesting discussion. Thanks to all the participants who were very active on the chat. I'm going to go and read all the chat messages after this. This was great. Thank you so much. I'm going to turn over now to Aaron Salzberg to close this session and make the final announcements. There you are, Aaron.
Oh, thanks, Clarissa. What a great panel. And, you know, it's one of the things we always trying to do is to find the next set of champions in our sector. And you couldn't do much worse than selecting from this panel. What a great job everybody did. So thank you so much. It was great to hear from all of you, and just amazing points and amazing chat going on at the same time. A couple of quick announcements. One, again, thank you so much to our sponsors who make these plenaries, but also the rest of this conference possible. It's incredibly important. And again, we really appreciate all the support. The late early shows, just to remind everybody, for those of you who have not been involved, we just had one of the late early shows this morning in South Asia. incredibly vibrant conversation where we get to take the conference out to the field and we get to talk about what's really going on with some of our regional counterparts. And for those of you who want to continue the conversation and really get down into the nuts and bolts of it, join some of these late early shows. It's a fantastic opportunity to be able to do that. I also want to encourage folks to join some of the events later on today. We do have poster sessions going on, side events, verbals, and there is a networking event beginning at 3:30, which those of you can join. It is a little bit of a challenge. You have to move over to Remo, which is a slightly different platform. But when you do get into it, it becomes really easy to kind of move around, to visit our sponsors, engage other speakers and things like that. So I encourage folks to join us at 3:30 Eastern Daylight Time. And of course, do join us again for the plenary tomorrow on the future of WASH. We'll get to hear the latest from the Lancet Commission. I also do want to say an apology to all of our participants for some of the complications again this morning and the lack of translation services for today's event. We are still working to try to make this all happen. As you know, it's a technical world. We're all adapting to new changes. We're doing our best, but thank you again for hanging with us, and we really appreciate it. And again, congratulations, Clarissa and the panelists, for a great event. Take care, and we'll see you in a few minutes.